Hi everybody, Dr. Sia here. Welcome to the What's the Diagnosis series. If you haven't checked out my intro video on this series, make sure you do that now. In this video, we're going to be working with Mark, who's attended therapy, and we're not quite sure what the problem is that he's experiencing. What's really good about this video today is that we're going to pause it at some point and you're going to get a chance to develop your own hypothesis about what's going on for Mark. And then afterwards, you're going to hear me develop my own hypothesis. And after the session is over, you're going to also see the wrap up where I discuss a little bit why I said what I said and what I did and why I did what I did and so on and so forth. So make sure you stay put and I'll see you at the wrap up. Mark, what are the problems you've been having?
Well, I guess I've just been feeling a little bit down.
A little bit down?
Lately.
Mm-hmm.
And my wife recommended that maybe I should try talking to somebody.
Okay.
This is not something that I've done before.
Okay, yeah.
So, but I thought, happy wife, happy life, right?
Yeah, and when your wife is happy, you tend to be happy as well, which
Correct.
is a really good thing. And you're finding yourself being generally happy in life, but a bit down at the same time.
Mostly, yeah. I've always been a pretty positive kind of,
Sure.
I've never been a low energy individual.
Okay.
But yeah, just lately I've not quite been myself.
All right. Okay. And any other areas of your life that you find are affected as well?
Well, it's there's something my wife said to me a little while back that's sort of been on my mind, and it's a little embarrassing to talk about.
Oh, that's okay. It's okay.
And it's also going to sound like it's one of those things that doesn't sound like a problem, and it's something that I've dealt with for most of my adult life.
I understand.
And it's to do with my performance, shall we say, in the bedroom.
Okay, I understand.
And
you're talking about your sex life,
right?
Yeah,
correct. It's again, this is a non-traditional problem, but my issue is that I've always been my performance has always gone on for a while.
Okay.
Which I've always thought of as an advantage.
Yeah.
And mostly reviews have been great. But I only recently got married, right? And this is my first real relationship. It's all been really casual before this.
I understand.
And I've only been married for about a year and a half, something like that.
Yeah. Okay.
And I thought everything was fine.
Yeah.
And then I found my wife sort of being less inclined to participate.
Okay.
And I kept asking her about it. And
Sure.
then finally she came out and said that lately it's been feeling like a chore for her.
Yeah.
Because she's ready to finish and I'm sort of
and you still keep going
on.
Okay. I can see what you mean with it not being a traditional problem.
Right.
Yeah.
Right. And she's done, and I'm still going on, and it's sort of it's just physically it's a toll because now it's the honeymoon period's the honeymoon period, but now it's real life.
Yeah.
We both have jobs and things to do, and it's sort of it takes a lot of energy out of her for her day to day.
Okay.
And
you've been sort of this as this is happening. Did this sort of start happening when you start feeling down?
Well, I've had this for a while.
Longer than you've been feeling down?
Yeah. Yeah.
So how long has this actually been happening? I think you said for the
most of my adult life. I've had this forever. It's not been a problem.
Okay, until now.
Right.
I understand.
Right.
So you would say that you're almost starting feeling down as a result of this problem, as opposed to the downness causing this.
Right, and it's not. Right. This is not just something that happens there and that we just leave it in the bedroom when we come out.
Of course.
It affects. One of the things that it's not just me. It's affecting her too.
Of course.
She's starting to feel like maybe she's not attractive. I don't find her attractive enough again, because this was my first serious relationship, and she knows that.
Okay.
I've sort of been kind of a
Casual relationships.
Right, this whole time. So
Right.
she's starting to feel like maybe I'm tired of the stable life, and I miss my other life.
And is that true at all?
It's not true
It's
at
not
all.
true at all.
I'm
Okay, you've just
completely
always
happy.
been like this, and you're complete. And when we're talking about how long it takes for you to orgasm, well, how long are we talking about?
30, 40 minutes
30, 40 minutes?
sometimes. Yeah,
And is that sort of on the shorter end or on the longer
it's
end?
probably on the short end.
The shorter end, okay.
Yeah.
And on the longer end, how long are we talking about?
Really self-conscious saying this.
No,
Maybe
it's
just,
okay.
Just let's say
of
just
course.
over an hour or something.
Over an hour or something,
Something
okay.
like that. Yeah.
2-3 hours sometimes.
Sometimes
Okay.
I've sort of cut back on that since getting married.
Uh-huh.
So it's in the sense that I'm actively trying to get there quicker.
Okay.
But again, it still doesn't. It's still not anywhere near normal.
I understand.
From what
I understand.
Yeah.
And so it's the kind of thing where no matter how aroused you are and how little time the two of you have to keep going quite intensively for 30, 40
Right.
minutes minimum.
That's correct. Right.
And on average, you have to go intensively
More than
plus
an hour.
plus
Just
1
over
hour,
something
2
like that.
hours, 3 hours,
Yeah.
and then obviously. And that's the part where you say that for your wife it's starting to become a bit of a chore where no matter the situation.
Yeah.
And does it then happen that sort of she's done much sooner than that and then you just keep going and going
Right.
and going?
Right. And it's just I mean it's physically tiresome.
Sure.
And it's mentally draining.
Of course. Yeah.
And it's like I mean I don't want it to be a chore.
No.
for
No.
her. Because this
of
is supposed
course.
to be a
Good times.
something for
Yeah.
both of us.
Yeah.
And the fact that now I know that she's not having a good time
Sure.
makes it worse for me.
I understand.
And because
Yeah.
I'm not just using her to get there.
No, and was it always like that where it wasn't a good time or were the two of you sort of enjoying it in the beginning
In
and then
in the beginning it was great.
yeah.
But as I said, we're down to real life now.
Yeah.
It's not that part of
It's not the honeymoon period.
It's not the honeymoon period, it's not the dating, it's not just the meeting for dinner and
Yeah.
having fun. It's living together, we do our daily, clean the house,
I understand.
all that, all the adults, the
Yeah.
real adult life.
Yeah, I
not
understand. I understand. Yeah.
Yeah. So that sort of response. We used to live separately before, and I managed my own thing by myself. It's on top of all the adjustments we're having to make,
Of course.
getting used to living with each other.
That's right.
This is an additional kind of a burden.
It sure is. So it sounds to me, Mark, that you might be experiencing something that quite obviously here is called sort of delayed ejaculation problems.
Sure.
And it's a problem that's very common for people to not come and see a psychologist about. So you're very right about that, because obviously when we talk about society and the kind of ways that men are pushed into or expected to perform really long, we've all seen those movies or heard those comments around, my man can go on for however long. And it's normally something that's not seen as a problem. So I understand what you say when you say it's the kind of like no problem.
Yeah, put it on a bumper sticker.
Put it on a bumper sticker, exactly. Announce it, and I'm assuming that's been something that's been quite nice for you for a while. But now that you're in an intimate relationship, a caring relationship, you're starting to see that it's starting to pull a rift between the two of you, and you want to deal with it.
Yeah.
Am I getting that sort of right?
Yeah, that's pretty. Yeah,
Okay.
that's it. Sort of in a nutshell.
All right.
Yeah.
And I mean, I do deal with distress and things like that, but it doesn't sound to me like your problem in this case is psychotherapeutic in nature. It doesn't sound like you have depression or anxiety or anything like that that's causing this.
Mm-hmm.
Am I right about that?
Well, I mean, I wasn't sure. But, I mean, as I said, my wife suggested talking to somebody.
Of course, absolutely.
There's nothing else wrong with me.
And your wife suggested that you talk to somebody so that you can get the sex stuff dealt with.
Well, I mean, thinking back, that's probably what she meant. I thought she was talking about just the fact that I've been feeling a bit down lately, and she's not used to seeing me like that.
All right.
But yeah, she's probably, she's it's a lot more perceptive.
Okay.
On just generally,
Right.
especially when it comes to me. I'm not.
Sure.
Yeah.
Well, look, I'm happy to be here and keep supporting you if you find that this is distressing to you. But I do have a colleague that I can refer you to. She's sort of a sex therapist, and she can help you, because what I notice is that you're saying that sometimes it's on the lower end and sometimes it's on the higher end. It means like there's some variability there for you as well, and she can help you maybe work towards that lower end with ideas that you can have in your mind, like imagery, with some exercises that she can tell you what to do, educate you about, and then you can practice perhaps with your wife and by yourself as well. And then hopefully over time, as you practice these exercises, you'll find that you can stay on the lower end longer or more often, and then you might even be able to push the lower end a little bit more to where you want to get it.
Sure.
How does that sound to you?
Sounds great.
All right, well, let's do that.
Excellent. Sounds good.
All right, so that was the session with Mark. Now, what did you think it was? Because my thoughts there were that this is something that we call delayed ejaculation problems. Now, it's not something that people commonly come to therapy for, again, like you saw me talk to Mark about, because obviously often in society it's actually appreciated to have this kind of delayed ejaculation. And Mark said himself, yeah, it was fine when he wasn't in a relationship, but then when he got in a loving, caring relationship, it got a little bit more complicated, because sometimes, they want to just be able to run off and have a quickie or something, and they can't do that. And sometimes it does feel a bit like a chore. But what was really interesting was that in the beginning he came in, he almost alluded to the possibility that he might be depressed, right? He said, low mood, he's not feeling really as energetic as he used to be. And we could have gotten stuck there, but we didn't, luckily. What we did was we really made sure that we found out what happened first. Was it the low mood that happened first, or was it the delayed ejaculation problems that happened first? And then what he said was that no, the delayed ejaculation problems have been there first, and now when he's in this intimate relationship with his wife, he's starting to find that the problems are getting more and more, because he wants to be able to be close to her, he wants to be able to please her, but she's finding that it's becoming more of a chore, and that's sort of starting to affect his mood. Not to say that he couldn't become depressed over time because of something like that. You could, but in this case, I don't think that that's what was happening. Now, what was really interesting also is that what we saw is that for Mark, there was this sort of variance or difference between how quickly he sometimes would orgasm and not. So sometimes it would be 30, 40 minutes, and sometimes it would be much longer than that. But it did suggest that there is some room there for improvement, and there's some room there for him to reach a sexual satisfaction that he wants, and presumably his wife wants as well. Now, it's not the core business of a psychologist to do those kind of things. I mean, it's good for us to know. But so what I recommended is that I'm going to refer him to a colleague of mine who's a sexual therapist, a sex therapist, and then she can educate him a little bit about what kind of things he can do, the skills and techniques that he can use to reach optimal climax for him at a time that suits him and his wife together. And that, I think, is such a perfect example of the use of psychology and psychotherapy, that sometimes people come to you and they think that they're really possibly in big trouble with the problem that they're having, and we can find out together that perhaps the problem isn't as bad as you thought, or perhaps there's a circumstance problem, not another problem. Our job is so varied, and that's one of the most amazing things about this. I really hope that you enjoyed this video and given it a chance yourself. I hope you weren't too embarrassed about it, but obviously that's the way it is. Sometimes we have to talk about things that's hard to talk about, even though it gets embarrassing and we end up laughing about it. And that's fine too. We're just human in the end. I hope you enjoyed it. I'll see you next time.